Hi, everyone, and welcome to another edition of Public Health Career Conversations. I am very happy to have with me today Dr. Vuyiswa Kumalo. Vuyi is a final year registrar at the University of Witwatersrand in Johannesburg, and she has taken some time today to describe what her journey has been like, as well as what her training journey has been like for all of those who are considering public health medicine as a career. So we thank you so much for joining us today.
Thank you, T. I'm looking forward to it.
Great. So the first question is really about why public health. So a lot of colleagues who are thinking about venturing into public health, either as a career or even just as a way to augment their knowledge around the health system and health as in general, are struggling with the decision around, what would make one go into public health? What were some of the factors that you considered when you decided to pursue it as a career? So would you be able to just, take us through that? What really sparked your decision, and what were some of the things that you took into consideration?
Okay, so before I actually went into public health, I was in emergency medicine, and if you can believe that. And I really did enjoy it. I loved it, helping people right there at the front line, at the coal face. But then I started realizing that, okay, sometimes I'm seeing the same patients over and over again with similar injuries or similar medical conditions coming in, and also just how it made me feel, working in that. I guess it's a very high stress environment, and I'm seeing all these patients, but I'm not feeling as if I'm really making a difference. Patients would come in with social problems as well, and as purely medical doctors were not well equipped to handle that, or even know how to speak to patients about that. So that started sort of my thinking into, okay, there has to be something more that I can do. Yeah.
Okay, great. So that is not an unlikely story. I think many of our public health colleagues worked in the services, and saw that they were making a difference, but it felt like a bit of a drop in the bucket. And there was a sort of curiosity about, can I do this better? So I mean, I think it's, especially in a country like ours, it's not unlikely that people see this, as you say, the social determinants, and think there has to be a different way to go about this. So thank you for that. So I think once you made that decision, then what made you then take the leap towards public health from emergency medicine, and what has been the journey since then?
Okay, so after I was an MO, then I'm doing emergency medicine. I actually took a break from medicine completely. For 6 months, I did not work. I stayed at home with my parents. I was fortunate enough that I was able to, move back home and get taken care of by them, because I feel I was really burnt out, from being in emergency medicine, because it's, high stress, fast paced, quick thinking. I mean, the rewards you get are immediate. And so that used to feel amazing. But then, it becomes so repetitively jarring, seeing such traumas all the time. And I thought, for my own mental health and my physical health, actually, I need to just step back. And so during my 6 months of work, I was exploring a lot of different options. Like I said, the thinking of, okay, still definitely want to be in the medical field, the health field, but wanting to do more, not just curative medicine. I wanted to practice beyond that. And I started looking for different job opportunities. And I actually came across an ad for a research clinician at the MRC in Durban, the HIV prevention unit. Took a leap of faith. I applied for the job, and I got it. So I moved to Durban to start a whole new life, working in clinical trials. So I was involved in HIV prevention trials, so looking at HIV vaccines mainly. And then when COVID came around, we were also starting research on COVID-19 vaccines. That work was very rewarding because I felt as if I had sort of a touch on both, you know, public health as well as clinical medicine, because I do really still enjoy clinical medicine. And my direct line manager at the time was a public health medicine specialist. She was actually our site leader, and we used to have such great conversations around public health, and then even around, you know, the whole research environment of clinical trials. And sometimes sitting in meetings with the funders or the sponsors of our trials, when, you know, they'd ask such hard-hitting questions like, why aren't you meeting the targets? What's happening? The way she handled herself was really, really amazing. Her thought processes, whenever we'd have presentations at work or discussions, really, really was so impressive. And I thought, okay, I think that's the person that I want to be. And started talking to her about public health medicine, and also an MPH, and, you know, she did the MEd, so she's a public health medicine specialist. And a post then came up at Wits. Once again, leap of faith. Applied. I didn't really think I'd get it because I was like, let me just do this. And then I got it. So the move was a bit protracted for me into the public health space. I know with a lot of doctors, you know, they know immediately after comm serv or even after a year of MO time, I want to specialize in such and such a specialty. But for me, my specialization journey actually started a bit later in my career.
Okay. So I want to say two things, you know, in response to what you said. First, I'm glad you said that you took a break. I think
yeah,
important, I think, for colleagues to know that that's okay. And like, you don't need to figure out your career immediately after comm serv. Like you say, some people know immediately, some people don't, and you need some time and exposure to the health system to figure out where your unique niche is. So I think that's a really great, and as you say, you are lucky. We know not everyone may have the ability to do so for various reasons. Maybe they, you know, so breadwinner, etc. But yeah, if you can, or even just think about ways to step out of your current situation, to just kind of recalibrate and think about where to next, because it can get overwhelming. And then the second thing is around the research clinician. I'm so glad that came up, because it hasn't really featured in the interviews thus far. And I think, there are a lot of people who go into public health from being research clinicians, because as you say, that is quite a lovely articulation of clinical medicine and public health research, you know, that sort of that space. So that is an option for colleagues who are in medicine and who are trying to bridge the gap, or are not completely sure if they want to go into public health completely. And as you say, I mean, you took a leap of faith. Very glad that you got the post. But the demand for public health specialist training is bigger than the amount of posts that we have. And so it is quite possible somebody may not be able to, you know, be taken into a program on their first application. And so these are type of posts that people should be on the lookout for, that give you a foot in the door and some experience around it. So I'm glad that you brought that up into the conversation. Okay, so now you are at Wits, right? So you applied and got to Wits. So maybe just talk us through, because a lot of the colleagues are quite curious, and we've done you know, a few webinars, and we've spoken to other registrars and other specialists who've kind of spoken about their training. But I think people would love to know from a registrar, like, what was the 4 years training like? What were some of the things you got involved in, and how was just generally the experience for you?
Okay, well, I was very, very nervous, to be starting the program, especially in undergrad in medical school. Public health isn't so much of a focus. You don't get a full rotation of public health as you would perhaps the other clinical specialities. And so I was coming in brand new. I even thought, okay, what did they see in me? Why did they think I could actually do this? But then once I met the other registrars, they all assured me it's normal. Most of us coming into the program don't really have a public health background. We're coming from, the the clinical medicine space. So the cohort of registrars that I joined were all very, very welcoming and quite supportive, which is something I'd really appreciated. I want to say, okay, clinical medicine mustn't hate me, but the support structure in, public health medicine from the registrars and the consultants themselves is so, so great. I'd never encountered anything like that in any department within clinical medicine. So I think I knew from there that this is going to be different. So in my first year, I was placed at Charlotte Matreka Hospital. Very much a newbie. I'm wondering, okay, what does a PHM Reg do in a hospital? What does the specialist do in the hospital? So I was placed in the monitoring and evaluation unit. That's where we get placed at Charlotte in our public health rotation. So I was learning a lot about data, how to manage data, data systems, health information systems. I was encountering words I'd never heard before, and concepts I didn't know about greatly. So it actually felt as if I'm starting a completely new, different degree. I was like, okay, is this still, some form of public health medicine? What is this? But I learned a lot during that rotation, such as, the importance of information, turning it into data that you can actually use for evidence to support the decisions that are made within the hospital. So that was great. At Barra as well, we rotate, and there we rotate within the clinical management suite. And it was a bit similar to the placement at Charlotte, except that it's more clinical management oriented at Barra. So sitting in a lot of the clinical management meetings with the HODs of the hospital, which can also actually quite be intimidating, because here I am, a first-year registrar, but I'm sitting in a meeting with the CEO, and you're feeling, do I belong here? Should I be in this room? But that's what I think is also so great about public health medicine, that it puts you into these spaces where decisions are made, where problems are solved, whereas as a clinician, especially when you're a junior clinician, you have no idea what's going on, and you just know you need to provide the services, and whatever happens in the management side, that's none of your concern. So it was really great coming with that experience of being a clinician and sitting in these meetings and thinking, okay, so that's why this happened. So that it's been very, very enriching. And so apart from being in the hospitals, I've also rotated through NIOH. That's the National Institute of Occupational Health. I'm very privileged to be there as well, to learn all about occupational health. They were placed in the occupational medicine section of the institute. However, there is opportunity to go through all the different divisions of the NIOH while you're there. I was also very excited to learn about occupational medicine and occupational health. It's not something you really think about, or especially of how it permeates through everything. You know, I'm even thinking about informal sector like hairdressers. What are the things they need to be careful about? And to, you know, the formal sectors like doctors working in the hospital, what PPE do they need? What occupational strains, you know, can they perhaps have? So that was a great rotation as well. And then also rotated through districts. So 2 districts, city of Johannesburg and then city of Ekurhuleni. I'm currently based at Ekurhuleni district now, so that's the rotation I'm in. And these rotations are sort of show the basis of how a district health system functions. So we're placed in those rotations so we can understand that, okay, from the district point of view, this is how health is managed in Johannesburg or in Ekurhuleni. So lots of exposure to, once again, things I'd never encountered before. And it was really, really great. I worked on some outbreak investigations in the district. I was at Johannesburg district when the cholera outbreak happened, and it was very interesting to see that there actually is a process to all of this thing. You know, you don't just get the alert like we see on the news, like cholera outbreak, and then you wonder what happens. But there is a documented process. There are steps that are to be followed. So that was really, really, really great as well. And that's where I also got exposure to private partners in health. So not just the Department of Health, but others that get on board to provide health services to our population. So lots of NGOs, sometimes private funders, and seeing the engagement and interaction between the private partners and our public sector was something I also was never exposed to before. And it really opened my eyes to how our health system really functions. Yeah, and so that's sort of been the training in terms of rotations. I also do attend modules. So at WITS, we do have modules that we attend as part of our training. We do, I think, a maximum of 4 modules a year. So the modules cover basic concepts in public health. We cover medical statistics called biostats, which was a whole new language to learn as well. We covered epidemiology, we do health economics, so a wide variety of modules that would equip us as public health medicine professionals to be able to actually improve the health system in our country.
Okay, awesome. Thank you for that. I think that gives a really great snapshot of the training efforts. I think just for anyone who is watching, there's maybe a slight bias on my behalf because I'm also a WITS trained PHM. But in terms of the rotations, I think because the WITS, UP, SMU are all based, sort of near institutes like the National Institute for Occupational Health, the National Institute for Communicable Diseases. You do have exposure to those institutions the way you may not be in other universities. Having said that, everyone is expected to be competent in all of those. So you may not get the experiential learning of it, but you do have to ensure that you know all of these sort of subfields within public health. The WITS training is set up very much so that, as you say, there's the Barra and the Charlotte rotations are around health service management. The district as well is around, management of programs and primary health care, etc. And then there's, occupational health and environmental health, which you'll get at NIOH, and then outbreak response, which you can get either in the district or at NICD. And so it is really a well thought out set of rotations, and really packaged in a way that you can get through your competencies within your four-year period. So that, I think, is a really nice reflection on the different rotations. So having said that, and you've spoken now about, the support within public health, and I do want to say it is one of the, people ask a lot about, can you have kids while you are studying public health, or, what is the quality of life? And it is one of the specialties that does allow you a bit more flexibility. That's not to say that you don't sometimes take home work. You still may need to be, sending a report or doing things. Sometimes, depending on where you work, it can be just as busy, especially in governmental structures. Could be asked for things at any time of the day and night. But there is a bit more flexibility in taking charge of what your day looks like, and being able to manage your life outside of your career as well. And like, the colleagues are quite supportive. The system in itself is also quite supportive of that. And then the last thing I want to pick up is just around the, you said that it is a bit daunting to come into public health from clinical medicine. And I think there's two sort of experiences. A lot of people may have done an MPH, etc., and are so familiar with the terminology. So that would be also a suggestion to anyone watching is, go and do an online course or a diploma or something. It will get you familiar with what the science is behind public health. But again, that's not to say that you have to have an MPH. We go through periods where there's quite a few doctors who came just immediately post comm service or straight from clinical services. But then, when I was studying, there was a lot more people who had MPHs. It just depends again on the person when you are applying. And so it doesn't mean you have to have an MPH or you have to, be from the services, but you can give yourself a bit of a boost up by knowing the terminology and doing some of these courses. So, yeah. All right. So my last question then is the one around advice for our colleagues out there. And I know it's difficult sometimes because everyone's journey is different, but I think, you seem to have done a lot of a lot of, myself included, kind of just fell into public health by, circumstances or whatever it is. You seem to have taken quite a considered approach to it. So, maybe speak about some of, again, reflections that you had while you were thinking this through, and what advice you would give to someone who is at a similar point in their journey.
Okay. Well, firstly, I think it's more general advice about perhaps seeking specialist training post community service. I know that sometimes there's a lot of pressure to be specializing, and you may just make a decision based on, okay, all my peers are doing it and my career needs to move forward, so let me just jump into it. But I think sometimes taking the time to really think it through is really, really helpful. And that was the route I took, because I knew that, okay, I would probably specialize, but at the time of graduation, I didn't know what I would love. After finishing internship, I enjoyed most of my placements, and after comm serv as well. So taking the time, because this is a very big decision that you're going to make. You have to be happy, because this is likely what you'll be doing for the rest of your life. So that would be the sort of general advice I'd give to anyone. And then in terms of public health, I would say exactly what you said, Atia. Maybe take up a short course, maybe register for a diploma, do the masters in public health if you'd like to know a bit more about it before committing to a full 4-year specialist training. That may be helpful, and it will also guide you on, as you mentioned, the science of public health, the language, what it actually is, and that's what I'd say. I have also had potential public health medicine registrars reaching out to me on LinkedIn. It's happened quite a bit, and it's been really, really awesome to engage with people speaking about public health. I ask them what their interests are. Sometimes we've had telephone calls, Zoom meetings, you name it, it's happened. And so I think if you would like more information around it as well, reach out to whoever you can find, probably in a Google search or from LinkedIn. You're like public health medicine. I think most people have their contact information out there, so don't be scared to reach out, send a message. Sometimes we are also the first to know when there's a registrar post available, and we can then send it out in that way. Yeah, that's the advice I have.
Thank you. So I think, yes, the taking time resonates. I think that will resonate not only with doctors, but anyone in their career, because there's always this pressure that should I be evolving? Should I be moving to the next step of my career? And as you say, a lot of people, I think, especially in South Africa, if you get into tertiary education, even if it is something that you are somewhat aligned to, you may pursue it because it's such a sort of privilege in this country. And so a lot of people do come out of their tertiary education and go, okay, but now what? Like, I didn't envision this for myself, or this is not exactly what I thought. So, taking that time and just figuring it out is good advice for anyone who is in a career and not feeling pressured to go with the usual path, or what you think may be expected of you. And then, yes, again, around the reaching out, I think it does help to speak to a lot of people. I mean, partly the impetus for this was because there's a lot more people wanting to know about public health. And so the set of, videos, as well as the 2 videos or the 3 webinars, around training, will give people some insights into it. And then you can actually approach people with targeted questions. So if you watch the webinar on MPH training and you have an idea on where the trainings are, you can then approach the specific training institution with really targeted questions about what your thoughts are, instead of spending time just trying to get information around it. So I think that is the value. And as Vuyi says, reach out to people. All of the people are tagged in these LinkedIn videos, so you can see who they are. But also don't feel disheartened if someone doesn't get back to you. People are also busy. Sometimes they miss things, and it's not that they don't want to, but it just may be circumstances at that time. Okay, so thank you for that, Vuyi. This has been really great conversation. I think just before we leave, any last words for our colleagues out there?
I would say I really love public health and public health medicine, especially because of the lateral thinking that's involved. As purely a clinical doctor, we tend to just have a sort of blind sort of focus and think in a particular way, unless, the situation calls for a broader perspective. But with public health, the broader thinking, the lateral perspective is your baseline. And that's something that I've taken into not only my public health medicine training, but also other areas of my life as well.
That's a really lovely reflection. Thank you so much. Okay, so I'm going to leave it at there with that those last words from Vuyi. Thank you so much again for taking time out today to help whoever is watching out there, gain further insight into some of the factors around public health that they may want to consider as part of their decision making. So thank you so much, and very excited to see what happens post-training.
Me too.
Thanks, Vuyi.
Thank you. Bye-bye.